name is Nadia. I'm one of the point people for Zoomers to Boomers. Omar is the other one. He will be joining us soon. I live in Miami. I'm 18, and yeah, I've been with the Raven course since March, and it's been amazing. Now let's go to Ray.
Hello, my name is Ray. I use they, them pronouns. I am currently based in New Jersey, where I am in high school. I am currently a lead Raven for the Growing Beyond the Recipe Corps here at the Raven Corps, and I'm so excited to be here today.
Hi, everybody. My name's Anata. I'm 17. I'm from the Bay Area in California. I'm also a lead for Growing Beyond the Recipe with Ray and Rowan and a couple of all the other birds. And yeah, I'm excited to be here. Let's pass to Rowan.
Hi, my name's Rowan. I use he, him pronouns. I'm in Gresham, which is just east of Portland. Also lead Raven for Growing Beyond the Recipe, and I run Tea Time. And I'm excited. Let's pass it to Bryn.
Hi, everyone. My name is Bryn. I go by she, her pronouns. I'm from Portland, Oregon, and I'm 26 years old. I'm 27, actually, just my birthday. I guess I'm suppressing it. I'm 27 years old. I'm a researcher at OHSU in the endocrinology department. I'll pass it to Kevin.
Hi, everyone. I'm happy to be here. My name is Kevin. I go by he, him, his pronouns. I'm 28, and I'm a researcher at the University of California, San Francisco. I study like the biological basis of diseases, specifically in different ethnically diverse populations. I'm really happy to be speaking to everyone. I'll pass it on to Daniel.
Hi, I'm Daniel. I am in Portland, Oregon. I use he, him, his. I am used to being the oldest person in many rooms, more so today. I am 72. I am director of a master's degree program in nutrition and functional medicine at the University of Western States here. I have been a vegan since 2005. I play music. I write songs. I have an album of animal rights music. Georgina, did you introduce yourself yet?
I have not. Thank you. Thank you. So my name is Georgina Martinez, and I am 50 years old, and I go by she, her, hers pronouns. Jesse reached out to me, asked me to join as a Gen Xer, and so I am here. And I guess I will pass it to Arjun.
Hi, my name is Arjun. I'm based in Gatineau, Quebec, in Canada. I study history and political science at the University of Ottawa. I was invited by Omar. He's my longtime friend from high school. I know he's not here right now, but he told me about this health equity discussion, and I was really interested, and so that's why I'm here. Nice to meet everybody.
Thank you so much, guys, for introducing yourself. That was very interesting to find out more about you. What has your personal experience been with the healthcare in the U.S.? Have you ever received treatment outside of America? And if yes, what did you think about it?
Well, I can start. So I have never received treatment outside of the U.S. I have just been U.S. my entire life. I grew up in more of a low-income family. And so treatment was always had to be within if it was in your medical group, then wasn't able to go outside, specialists, anything like that. So it was always very low income and what was available within a certain realm of medical degree, if you will.
Honestly, I am also from a low-income background, so it has been very limited just to receive any type of healthcare, honestly, from like a flu to more serious issues. And just seeing the difference between how it's available for me and like to people outside of my community is just kind of shocking. And I've received healthcare opportunities outside of the U.S. because I moved here when I was 12, I believe. So, and it hasn't been great in Russia. where I'm from, but at least we received some of it. Here, it's like if you don't have money, you're not going to receive it at all. Arjun.
Oh, I realize that so far I'm the only Canadian one here. So anybody who asked about if you received healthcare outside of the US, like I said, is my case. I've only been to the US once, so I haven't been, but like I do hear stories about the American healthcare system, but like obviously in Canada, the single payer healthcare system, it has, obviously there are holes in it. But you know, it somewhat allows an equitable access to healthcare. I'd never had to like worry about, you know, going to like the hospital or whatever.
I can go next. So I come from a place of extreme privilege, but it's a little bit different from a place of Western medicine because my dad's a chiropractor. And because of that, I haven't had to really go to a lot of hospitals or things like that because my dad kind of understands what to do if like my sister or I get ill. And he has a lot of doctor friends who work in hospitals and things like that. So if I ever needed help, we would just go to them. But in the case of broken bones and things like that, he could just take me to his office and I could just get an x-ray. I have gotten healthcare outside of the US. I'm unfortunately deficient in a lot of things like iron and like I'm anemic and all these things. And so I get kind of sick a lot. And in Singapore, I went one time and I like bit a hole through my lip because I had a dentist appointment and my lip was numb. So I bit like an actual hole and I had to go to the hospital there. And I was too young to remember anything, but my dad said that they didn't pay anything out of pocket. They just paid like, I think it was like a really low amount, like $20 or something like that. It wasn't anything like in the United States. And recently we went to Sardinia and I hurt my back and they had to give me a shot in my back for the pain because we were traveling the next day. And my parents only paid like $15 out of pocket because the Italian government took care of it.
Hi, I just wanted to introduce myself because I showed up a bit late. My name is Omar, and I will also be helping Nadia facilitate this meeting as well. Kevin, I see that your hand is up.
Yeah, I just wanted to share my experience as well, since everyone else has. And I'd say I grew up here in the States, but my parents actually immigrated here when they were in their 30s, and they don't work in healthcare, so they were they weren't literate when it comes to the healthcare system, especially in the United States. And I'd say that's like followed us through kind of our growing up because, you know, annual checkups are commonplace, but not in my family. So if there were, you know, issues related to your health, it's kind of like you suppress it unless there's something, you know, completely wrong, like you broke a bone or something. But
I experienced a lot of the American healthcare system as a kid, as a patient. As I got older, I got healthier, actually, which is, I mentioned that in part because I want you all to know that that's possible. As a kid, all sorts of asthma, allergies, eczema, that whole syndrome. And I think changes in diet helped. I think that probably some things you just outgrow. It's hard to sometimes distinguish one from the other. As an adult, I've mainly experienced it as a practitioner and an educator because I was a chiropractor too. I practiced for many years and before becoming a professor. And I think that in the U.S., as probably we all have seen, there are good sides and bad sides of conventional medicine. There are strengths and weaknesses. And we aren't necessarily taught when we're young which those are, you know, but I would just say that as a chiropractor, I saw times when working with patients, whether that was through spinal adjustments or nutrition or lifestyle medicine things like teaching people to meditate or encouraging them to move more and exercise. I think diet-wise, since I'm teaching that these days, I would say that if everyone, well, first of all, I wish the whole world would go vegan. I became vegan for the animals, even though there are other good reasons. But I think that if everyone ate a whole foods diet and cut out the vast majority, if not all, of the processed foods and sugar and processed fats, that would solve, I don't know what the statistic is. I don't know that the statistic exists, but 80% of health problems, so many of the chronic diseases in the US, diabetes, heart disease, hypertension, and all the rest, cancer, are preventable in large measure. Not in all cases, but in many. And I realize that two of you who I'm seeing on the screen are researchers, so I'm imagining that you've learned some things along the way about strengths and weaknesses as well. And as for the kids who are with us, pardon me for using that term, as for the younger people who are with us, I would say trust your own body, trust your own instincts, and be open to thoughts that others have.
So I just have a follow-up question that anyone could answer. So do you feel as though an individual is responsible for their own health as opposed to the government being responsible, at least to making sure that the individual is more healthy? And this is for anybody to answer, or you, Dana?
I would say in the US, it definitely feels like your health is your responsibility. I mean, as far as, not just physical health, but all layers of life, your life is sort of like, if you fail, that's all on you, when in reality, so much of what affects our lives is entirely out of our control and, subject to random chance. But I grew up poor, and over time, my mom's made her way up and works in healthcare, which is some stuff I know. So we're definitely solidly a middle class family now. But when my dad has a hernia, and when my parents didn't have insurance, the doctors were like, "Oh, if your stomach pops out, just push it back in." And then yeah, and then he got insurance, and they're like, "Oh my God, yeah, we're gonna put some stitches in there and fix it up." And they put 2 stitches in, and the stitches popped after my parents had gotten changed careers again and again, didn't have insurance. And then when they didn't have insurance, they're like, "Oh yeah, just push it back in, you'll be fine." So you fully have 2 different healthcare systems in the US, whether or not you have money. And it's if you have money, you have access to one of the best healthcare systems in the world. And if you don't, you don't. There's a guy who will be like, "Man, it's better than a dirty, poke with a dirty stick in the eye. You get lost, bum." So it's very different. The biggest thing for me now dealing with healthcare is the paperwork of it. Being trans and going through trying to medically transition, it's I had to go through months and months of just telling other specialists things that I already knew about myself. Are you sure you're trans? It's so pandering, and they look down on you the whole time. But it's if you're poor, you don't even get to have people talk down to you. You just sucks to suck, deal with it.
Yeah, and I guess that leads, which also the whole story about your dad, that is really messed up. That is really sad to hear. Also very tragic. But it leads us to the next question. And do you feel as though you have full access to healthcare? And you're talking about your experience as a trans person, Rowan. And would you like to elaborate on that?
Sure, yeah. I now am very privileged in that I have access to insurance that covers not just physical health, but sort of mental health things as well. And one of those things is through my insurance, I have access to a gender pathways clinic through my insurance, which just at all made it like a feasibility for me to transition, because I have so many friends who they're not allowed agency over their own body by their parents, so they can't choose to transition, or they do have the permission but they just don't have the financial resources. They're like, boy, it would be nice to afford that. I guess I just get to suffer because it's not going to kill me if I don't. So you just got to deal with it indefinitely. And for me, it was pretty much all paid for by my insurance. My copays are really low. I only pay for the injection needles and not actually the testosterone itself. And for me, it was months and months of paperwork and monotony and phone calls. And this is with everything in the same insurance house, going through the door, it's all under one roof. It took me months of pure bureaucracy to just get in the door, to see the changes physically that I wanted in myself to make me more comfortable in my body. And this is with just about every, access to privilege that you could have in this situation. Got full insurance, I'm white, which is a huge thing, especially with mental health stuff. And even then, it was a challenge. They make it hard on purpose, it feels like.
Yeah, no, it does sound like you went through an ordeal in itself on top of trying to transition. The whole healthcare system added extra obstacles, which is really sad. Does anyone have any experience similar to Rowan, or have something to respond to what Rowan said?
I would like to speak on this. I also am a trans person, but unlike Rowan, I have not had the ability to transition yet. I mean, I'm not planning to transition fully ever. I'm non-binary, so, there are things that I feel comfortable with and there are things that I want. The one thing in particular that I really am in need of is top surgery, and the fact is that it is so expensive in our healthcare system. I live in New Jersey, which is a relatively progressive state, and as such, there are there's a couple of surgeons in the area who can do it. I'm sorry, my alarm is going off. But the fact is that it's so expensive that if you don't have insurance that covers it, you aren't able to get that health care, and you aren't able to get that necessary gender-affirming care that you need. And a lot of people think that gender-affirming care for trans people is not necessary, which, is transphobic all in itself, and how, screwed up the healthcare system is with silencing trans people and making it seem like trans healthcare is not actual healthcare and it's just a want, when in reality it is a need and people need to recognize that. But that's a story for another day. The reality is that if you so many insurance companies do not cover top surgery, and for me, I am so lucky that my parents have insurance that covers top surgery. I am unable to get it right now because non-supportive parents, but when I turn 18, I'm still going to be on that insurance, and I'm going to most likely be able to get top surgery off my parents' insurance, and only have to pay a small amount on it. So that is, I'm really privileged in that way, and I'm really privileged to be, a solid upper middle class family, and have the financial resources to be able to take care of myself and to get that necessary, gender-affirming surgery. But a lot of people don't have access to that. There are so many trans people. I see so many fundraisers on GoFundMe for trans people who need this necessary surgery, but they can't get it because the healthcare system won't pay for it. The insurance won't pay for it. And some people don't even have insurance because in America, healthcare isn't a human right. It's just, oh, you can die. I don't really care if you die. You can carry a gun around, but I don't care if you die. That is the way our government works. Is that some things are everyone's oh my gosh, you should totally be able to carry a gun, but they don't say the same thing about literally being able to live or die because of healthcare and how screwed up it is and how privileged you have to be to have access to it. I live in a really white area, and you can tell that everyone is able to live there, able to have access to that healthcare insurance, and there's a lot of really good healthcare places in the area because everyone is able to afford it. But if you go to a place say Newark, where the majority, Newark, New Jersey, and the majority of the community is, BIPOC or low income, you don't see as many of those, higher end establishments in there, because it's the result of deliberate policy choices that drive minority communities back and, prevent them from accessing these resources and prevent them from accessing healthcare, because in America, healthcare is not a human right. It's, it doesn't matter if you live or die, go fight it for yourself. I don't care. And so, it's just really inequitable, and especially for trans people when their healthcare isn't considered necessary. And so we have to fight to literally get necessary surgeries. Like there are, I know that some people, you cannot get top surgery at some surgeons if you are a minor. I know under my insurance, if I were to get top surgery right now, I couldn't do it because I'm not on testosterone, and because I don't want to take that, because I'm not. It's binary transness. They can't accept, they'll accept you if you're trans. We're getting to that point enough now where if you are trans, they'll, they're like, okay, but you have to be binary trans. You have to be female to male, or you have to be male to female, and you can't be anything in between, and you can't break the binary gender norms of our society at all. And so if I were to go up there and say, well, I don't want to take testosterone because I don't want to transition to be a male. I like the way my hormones are, well, not necessarily, but I'm choosing not to take tea, but in that instance, it would be considered, you can't do that because...
So do you believe, even though we're progressing, is it we're not filling in the gaps that we have when we're progressing, so a lot of people get left between?
I just wanted to comment on what Ray said and how it relates back to the question of, what are our personal experiences? I think that was what it is, or what services are you able to receive and not. I think, in Oregon specifically, and I know Ray, you're in New Jersey, but, there has been something recently either passed or about to pass about top surgery being covered by OHP, the Oregon Health Plan. And I do believe now if a physician codes it differently, then it is covered by OHP. And this is something that was driven, that was community driven, I would say, and rallied behind, endocrinologists and those who also give trans health care. So that's exciting in a sense, but I think it does highlight once again just how different opportunities are given in different areas. And I think the word that I feel like we dance around the word, but I'm just going to say it, disparities. It definitely highlights disparities. And again, this is just by location and state to state location. But something too, and it was an interesting thing earlier, and I guess I'm going to say it now because I have the floor. But I think the question was something like, how much is the government responsible for our health versus is it an individual? It's an individual's responsibility. I think ultimately, when you look at your own health, it is an individual's responsibility. But going back to, what is given and what we are given, what can actually be a feasible opportunity for you, that's really, I think, where we see disparities, right? Because of the access of healthcare, and it's, working as in the endocrinology department, we see a lot of times people with diabetes, specifically type 1 or type 2 diabetes. And you think about what is the price of insulin, who can afford insulin, that's a big one. But the second one as well is there's just a whole bunch of vast technology actually available for people to use that would drastically improve glycemia or blood sugar control. And that's just not available because of cost. So we look at those types of things. And when I, in my mind, when I get down to it, it's just that the United States in particular does not at all emphasize preventative care, nor does the actual system that we're given emphasize preventative care. So, and another, I'm sorry, I don't know anything, I guess, about any other states except for Oregon. But another thing too that I know, specifically Oregon has pushed for, and I think it actually is with Medicaid as well, but testosterone is now very cheap, not very, I don't like to say cheap, it's such a relative word, but it's more affordable is what I'll say about it, because there was a study done that's saying if you don't let people be who they are, then they are more at risk to suicidal ideation, which is just a no-brainer. But that's something that has recently, in the last couple of years, have been passed. And it's one of those things where it does illustrate once again that our health is our own responsibility, but how much can we progress with our own health? How much can we improve if we're not given the tools to do so? Long comment, sorry.
No, thank you for that. That was actually very insightful. I agreed with a lot of what you're saying, and I learned some new things too. So thank you for that. But it does also lead into another question, which would be, does the current healthcare system force some folks to treat themselves? And do you consider self-treatment safe and reasonable in any scenario?
So I'll go ahead and go. I don't think we should, as self, medicate. I think that I definitely feel that I'm trying to think of how I want to answer this. I don't feel that we should self-medicate. Number one. So I'm curious as to what Kevin's response is to that. And then let me think about how I want to answer that second part of the question.
Yeah, it's a tough question, and I also agree 100% that individuals shouldn't self-medicate. It's unfortunate that they often have to, given the circumstances of how expensive our healthcare system is.
Yeah, I want to say that there, you can be low income and, but there's still Medi-Cal, what California has as Medi-Cal available to low income. And, you do have to jump through hoops in order to get it available to you, but there are resources available.
I would like to say that the United States government for sure makes people self-medicate is an interesting word. I think self-treat is kind of more the holistic word we can think about it. And especially in cases where we see folks who are just not at all counted in a sense, like those who are undocumented. That's a great large population that would have to self-treat more often than not, or if they do treat themselves, it's always that issue of going to the emergency room and paying, hundreds of dollars, and that's pretty ubiquitous in every state, I would say.
There's a whole conversation that I think needs to happen around Western medicine and whether or not Western medicine and the medicines that they push, the medicines that are seen as required, are actually something that people need, or whether or not they're just tools of capitalism to profit off of the failings that the healthcare system itself has created, and that the healthcare system perpetuates in order to cause more sicknesses to push more medicines. Oftentimes, communities of color have more holistic or Ayurvedic medicines that are community-based, actually, and Western medicine tends to ignore these things because they can't capitalize off of it. And because community medicine is something that just, again, the phrase self-treat, I think, is a little problematic when we put it in this context, because if we place it into a different context, again, with holistic medicine and self-treat, like communities of color, human beings, we're meant to be able to self-regulate our bodies. Like, we know our bodies. We're supposed to rely on people who have knowledge to help regulate things and give us information about things that we otherwise wouldn't have so much insight about. But again, like, I was the secretary for my dad for a really long time, and I have just so many stories of his patients coming in being like, "Hi, Dr. Tran, they gave me this one medicine. Can you, because like I don't know what this is, could you like do some research?" And he's like, "This is not what you should be taking. This is a blood thinner. You need something like this is going to give you more pain. This is going to make things so much worse." And it's like, I really think that as a society, we should not be moving away from Western medicine, but incorporating more holistic approaches that make healthcare more accessible, because holistic approaches oftentimes give people the tools to understand their own bodies more.
I agree with all of what you just said, and I come from sort of the I'm very pro self-medication, and I'm gonna call it that to sort of deliberately anti-stigmatize the word. Because when you think of self-medicate, that brings into your mind, especially if you're from an older generation, sort of that like Reagan war on drugs era, where it's like you think of self-medicate, you think of an alcoholic who's making excuses, or you think of someone who takes their pills when they're not supposed to. We've sort of made the idea of self-medicine into a dirty word in our medical system that's built around capitalism. And, you know, capitalism does create innovation for profit. So we have lots of medical technology that's really expensive, but in a lot of ways, our medical system deliberately fails people. Like, we have a huge opioid epidemic in the US, and it's not from people, you know, it's a lot of prescription pills. It's not a lot of, like, heroin addicts are, you know, their own problem independently, but that's not where the numbers are. The numbers is in prescription opioid pain pills, because they make a lot of money prescribing those to people. My aunt had an infection in her cheek and had to get surgery done, and they put her on prescription opioids, and she took them as prescribed and developed an addiction. And at that point had to go to a methadone clinic just to become unaddicted to opioids. So my perspective on this sort of topic is that, you know, they are going to prescribe you with something. And, you know, whether or not it's something that is good for you or good for them is always a gamble in a capitalist system. So I try to self-medicate whenever possible. You know, I don't go outside of my knowledge range, outside of my comfort zone, but when I have a headache, before I take a pain pill or an aspirin, I drink water, I eat food, I dim the lights. And I apply that same sort of theory to all of my life. You know, I have this book of like horticulture and plant stuff, you know, and when I have ailments, I'll make a tea, and if that tea doesn't help, then, you know, I'll go talk to a medical professional when things are out of my control. But I don't feel that there's any need or reason to surrender any part of your physical body and autonomy to a medical system that seeks to profit off of you.
Thank you for that, Rowan. And does anyone have something to respond to what Rowan was saying?
Yes.
Yeah.
My experience is that I haven't, except in very rare cases, seen instances where I felt that someone in the medical system, including conventional medical system, was consciously trying to make things worse for people so that they could then sell them something to help them improve. But in my view, it is true that when we view the system as a whole, there are things that could help that are not being done that lead to that systemic problem. I also want to mention, with regard to part of that system, when I was living in Kansas City, this is maybe close to 10 years ago, I was part of a multi-professional, you know, with medical doctors, nurses, and others, pain consortium. And after a while, I felt that despite the good intentions of, it felt like all of us there, I wanted to understand who was supporting this, where the funding was coming from. Yes. And I had to go about 3 or 4 layers deep into the website of the organization to find it. And it was a now famous or infamous family called the Sackler family, who were the folks behind oxycodone. And this was, in my view, their way of, trying to give themselves a better name, convince themselves that perhaps that they were doing good to make up for the obvious harm. They had already been sued and lost for who knows how many hundreds of millions of dollars. And once I realized that's where the funding was, I quit. I mean, it was just corrupt. And unfortunately, I'm guessing, I don't have firsthand experience with too much more of that, but I think we always do need to follow the money and see who is truly trying to help and which actors are not.
I actually agree, because what you're saying specifically, because a lot of times it's not out of evil intentions and malintent. A lot of times it's just the way that people have to operate within the system. Sometimes they need to benefit themselves over benefiting patients, or as a whole, doctors benefit themselves as a group of people over benefiting patients as a group of people. It's not always individual malintent, it's just the way the system is set up. But yeah, just a lot of shady business going on in the US healthcare system, which leads me to the next question would be, do you think other countries' healthcare system would be better? Or would the US do better to adopt those type of healthcare systems? And I would like Arjun to answer first, since you come from a Canadian healthcare system, and you could provide some insight with that, and then leave the floor open for anybody to respond.
Yeah, so obviously, like, the Canadian system is a single payer healthcare system. You know, everyone pays into it through taxes and such. But there are still like potholes in it. You know, vision and dental care, they're not covered by the government. So I mean, obviously, I feel like it would be better for the US to adopt a more single payer healthcare system. It would ensure equitable access for most people. But obviously there are holes and gaps, and I don't fully understand like healthcare economics and like why people are against it. Like, that's one of the reasons why I came and put in the Google Docs. Like, I don't know why people are against a single payer healthcare system, like the economics of it. So, but yeah, I feel like the single payer healthcare system does work. You know, it could be better, especially in Canada, but
Yeah, I think if there was a level playing field, you know, of everyone being able to be offered the exact same healthcare across the board, there would be less, you know, homelessness, less, you know, mental illness, less, you know, it would just be a fair playing field. So it doesn't matter what your background and what you come from or what you can afford. It would just level the playing field for everyone.
So, actually, this is a subject that we were just talking about in one of my classes. And one of the central arguments actually about, like, against a healthcare system similar to Canada is that the problems that exist within our healthcare system are so deeply rooted in other things like food deserts and accessibility that promoting a system that is similar to other models like Canada would only make the middle class and upper classes profit more, and would leave the more, you know, obviously poorer people, like, let me word this better. When you make, this is obviously not what I agree with, but because I read what the other argument is, it's that when we say that this is a thing that should be universal, let's like say childcare, for example. We say childcare should be accessible to all people. We, you know, put it in our taxes. Everybody pays a certain amount. It goes towards healthcare or childcare universally. Really, the only people who have a level playing field is the middle class, because then they have cars, they have all these things that help them get to places where that would be accessible to them, cities or metropolitan areas where those things become entangled, and like food and all these things help within a system that produces a safe childcare system. If we put this in the context of healthcare, it's true that if we put this on a level playing field, more people will have access to it, but the target audience or the target people that we're trying to reach at, which are poor neighborhoods, still won't really have as much access to begin with, because again, they live in places that don't have grocery stores that have the healthiest options, or least processed foods and things like that. And so it all goes back to how the system itself is broken, and every individual part of the system is broken. And we can't begin to solve one part of it if we don't look at the whole view together. It's a puzzle, right? It's not just one little piece that we need to be hyper focusing on.
I was just going to say, I think like pulling in maternity care from other countries would be pretty nice, because I don't think women are really seen as like a social group. And then, you know, I don't know, or anyone who's like going to have the baby is not seen as a social group, and that takes a lot of work. And so I do know, like in the UK and I think like Sweden, we had someone in our lab who was from Sweden and was really surprised that women here, you know, don't really get a paid maternity leave, versus in Sweden you get a year. So
like I was thinking about wait, how do you put Anata? And like what she was talking about, like I do agree that it's like more systemic, where you know, if you do equal the playing field, it does only like the middle class, upper class, because like it is somewhat the case here in Canada too, where like obviously like hospitals and stuff, they're more like because of the COVID crisis, we've seen like the gaps in Canadian healthcare system, like in Brampton, which is like a suburb north of Toronto, for 700,000 people, there's only one hospital, right? But then in like Toronto, obviously there's like multiple hospitals, like just in the downtown, there's like 5 or 6 different hospitals. So I do agree where the healthcare system, even if it's universal, not everyone will benefit from it. But like at the same time, I guess making it universal would be like a step instead of a solution. Like I feel like making it universal would be a step towards, and then because when you widen that access, you're able to target then foods and, you know, like these medicines and stuff. Because like I think like, my understanding of the healthcare system is like in the 50s or the 60s, when Medicare was being pushed, it was like the American physicians, APA, like they're the one who, there was like a big campaign against it, because I know like doctors do benefit from like practices of private healthcare. So, you know, by making it universal, and like with Canada and like UK and stuff, because the government controls the price of the market, you know, doctors aren't allowed to like, there's only a maximum you can charge. While in America, I don't think that's the case. So if you were making it universal, it'd just be I'd say it's a step towards the right direction than the solution.
Definitely. Like within the US, there are just so many interwoven systems of oppression, like primary examples within like healthcare and our justice system that straight up are like genocidal towards the minority populations who live in our country. And to call it things lesser than, you know, like does truly water down the actions of our government in our country. You know, forcing racial minorities to live in slums, forced sterilization, things like not allowing people access to basic human rights, healthcare, voting. It's not that these forms of oppression have disappeared, but they've become more convoluted and less visible to the everyday person. They make it so systemic that you cannot blame any one individual for their actions, because it's interwoven in the way we interact with people. And without a person to hold accountable, the benefactors of this system continue to profit off of it without ever having to take accountability for it. So I think we have to change our medical system to something else if we ever want any true form of freedom or equity in this country. But I don't think it will solve our problems. I think we need to look at the way we treat individuals on a wide variety of different levels, and in you know, a serious severity that we often don't give it to truly address health problems in the US.
I 100% agree, especially about the point that it became very convoluted, that you can't blame any individuals. And does anyone have anything to respond to Rowan or to comment on the U.S. healthcare system in general?
I had an experience, again, when I was living in the Midwest. Sometimes there are people you can blame. This was, there was a commission set up by the Missouri state government, and I somehow got appointed to it, to my great surprise. And they had the opportunity to expand Medicaid. The federal government was going to pay 90% of the costs. And basically the Republicans in the legislature refused to do it. And in that case, I felt like I did, and I talked to these people, and they had their rationales, but to me, they weren't rooted in reality. It was that the federal government, we can't count on them actually delivering the money they're promising. And so in one of the hearings, one of the doctors who was on, it was part legislators, part health practitioners on the commission, one of the doctors said, well, have you had instances where the federal government didn't pay what the amount they had promised? And this was being asked of an expert who was testifying, who was from the state health agency. And he said only once, and that year they paid more than they had promised. There are many states in this country that are still like that. Oregon, where I now live, is not one of them, thankfully, but a whole lot of people live in those places, and I don't know what the answer is to that, other than federal legislation to override that. And it's tough, and it's profoundly sad.
Yeah, it does sound a bit depressing. And that does lead to the next question, which would be, what do you think would be a good solution towards working for a better healthcare system within the US, or working towards a good healthcare system in general?
From my point of view, aside from universal access and coverage, unless there is a deep cultural change toward prevention, toward healthy diet, and other lifestyle changes that we know that research has shown to be needed. I don't think that changing the payment system is going to solve the problem. I think the payment system needs to change, but that's not enough.
And Daniel, I think to add is that, all these issues that we're dealing with our healthcare system, we've all been pointing out specific components of this failed system, and it's also intertwined in our politics as well, and that is related to this cultural shift that needs to happen. And partly, I think it's going to be incremental change as with anything. And I think what will help, activism, at least with each individual component of our failed system. So we have, food deserts, we have cost of healthcare, we have how different marginalized groups are being affected by our healthcare system. And it helps that different professionals and researchers and all the players involved are trying to help out with each of the different components of our failed system. Whether we'll see that change in our lifetime, let's hope.
Whatever good any of us can do about any part of what's broken is worth doing.
And I do want to add that, we talk about our capitalistic system as being horrid, which it is, and but I think it's also helpful, as a positive note, that there are good people that just happen to have to be forced to work into our capitalistic system, and we are trying to promote change, even if it is incremental.
Definitely. And I think if we applied intersectionality to literally every aspect of the world, it would be much a better place. And if we uplifted the voice of people of color, it would just change everything. And that's, again, something that has to happen on an incremental level. But I think the United States has really profited off of isolationism, and people of color and a lot of non-Western societies live in communities. And I think that would solve so many more issues if we just all learned how to behave not so selfishly, because so many of our mental health issues and problems like that could have or will be changed and much better if we know that we have something to fall back on, if we have a support system that we can rely on when things get bad in every aspect of our lives, but specifically within care. And again, you shouldn't search for issues and answers to issues when they already exist. You're just ignoring the communities that have the answers for them. So I think it really just, it needs to be more of uplifting the voices that have already existed.
I think like a large part, it has to be like, I think in general too, it's like the profit-driven nature of healthcare. Like personally, I believe healthcare shouldn't, obviously it's like part of the failures of capitalism, but I feel like one like the beginning shifts of changes is like these things that are like necessary for human survival, like healthcare, electricity and stuff. I don't think they should be like profit-driven at all. I think that's like the basis of it. Like just like Daniel said, like it's like the payment, like changing the payment system, the prices is fine, but it's just like because like the entire system is built for profit. And I think like that's the problem, where when you have people doing healthcare for profit, there's no actual motivation. Like it's the same thing in Canada too. Like right, when I said like when the government controls the healthcare market with the prices and stuff, that's also a temporary fit. That's only temporary. But like the abolishment of this profit-driven market specifically for healthcare is like the biggest problem, because otherwise there won't be real change across the board, because as long as there's incentive to profitize, then marginalized people and poor communities will always be at the end, like will be at the bad ends of it.
At a very deep level, I think the profit-driven identity that we're talking about, the profit motive within healthcare is a perversion of the fundamental meaning of the healing arts. And by the way, I do want to say something about Canada. I have been recently reading the new US dietary guidelines that came out this year and comparing them for a class I teach with the Canadian guidelines that came out a couple of years ago. Each of them moved in the right direction, but the Canadian guidelines are just excellent in many ways. Far more whole food based, far more plant based. And the process that they use, speaking of the role of capitalism or profit, in Canada, they forbid the members of the panel that were developing the dietary guidelines, they forbid them from interacting with any of the basically food corporations until the final guidelines were released. Now, that doesn't mean that what they came out with is perfect. It doesn't, I don't want to idealize Canada, as some perfect place, but those guidelines really said something very good about Canada.
I think like that's like one thing I appreciate about living in Canada is like with like stuff like just like important decisions and stuff. It's like there are government induced protections for consumers and the people of like away from like the profit, away from companies. Like obviously it is a capitalistic system, but there are like government barriers, and when decisions are being made, it is made sure that like the actual citizens who are voting, they're being heard, compared like in America where it's like lobbying is like a huge problem, like a huge thing. Less so in Canada because again, like the government does put restrictions on what big companies can say in these audits, I guess.
Bryn, you were going wanted to say something earlier?
Yeah, I think I'm kind of going to switch gears and I don't know much about Canada, but thinking about the question of like what will help the current state of healthcare, I think I'm sorry, there's a loud bird. I think they're like looking at the things that do drive the changes of healthcare are something that we need to be, we need to look at and consider its robustness in a sense, because, what I'm getting at basically is, when we look at certain illnesses, so like asthma, which is actually something Kevin studied in his PhD, and this is why I know this, so I'm going to steal it, Kevin. But basically with asthma, it seems to be like, the most predictive thing for someone to have asthma in the United States is actually your zip code. So it's not really anything to do with genetics or anything like that. It's actually your zip code, aka where you live. And we found that those who are most susceptible to asthma are those who are Black in the United States. So because it is a raven too, by the way, but anyways, and we look at what is prescribed today in the United States, and it's albuterol, which is an inhaler. And we found actually that the efficacy for albuterol for people who are Black is dramatically lower than any other type of, any other type of person. And it's interesting that that's the number one thing that's prescribed in the United States is always going to be albuterol if you have asthma. And it is regardless of your race and regardless of your ethnicity, it'll be albuterol. But again, for some reason, it's not as efficacious in those who are Black. So when we look at that, it's almost like, that was something that was interesting that was brought up by a research study or research, and it did iterate the policy that we have now and drive a change for it to say, hey, maybe we should prescribe something else that actually works for the patient population. But again, just to get back to how I do think that the metrics that we practice and policy healthcare through are not exactly, robust. They're not exactly accurate. And so I think advocating for changes on that end, advocating for the questions that need to be answered is a great start to healthcare change in the United States, because it's very difficult to say, we need to be more like Canada. Like we probably do. But no one in the United States is going to accept that answer in this point in time. So I think small ways like that, by simply just asking the correct question and really following through with funding for those things, will help.
Yeah, I completely agree. And I have severe asthma. And, when you have asthma, you usually have the other two, which are allergies and eczema. And albuterol is so expensive, and usually you have to get that big tank and the mask in the winter because it gets dry and you have to hydrate yourself. And so you put all the different medicines in the little thing, and it makes all this noise. And when I was a kid, I would have to sit there for hours in the winter because I just had such bad asthma that if I didn't do it, I literally couldn't leave my house. And it's so expensive. And my parents, they work in Oakland, and my dad, he treats a lot of kids that have asthma, and my mom, she's a nutritionist. So something that I've been trying for the past 5 years is cordyceps. My mom grows it, you just eat it, and it's been helping my asthma a lot. And this is what I was saying earlier about how Western medicine really suppresses the cures, I guess, or things that make illnesses better, that other societies and other cultures already know, but they just don't want you to know it because they can profit off of this thing that happens largely because of pollution and because of your zip code again and where you are. And so that's something that my dad has been really telling a lot of his patients, because a lot of his patients in Oakland are people of color who don't have access to albuterol and the amount of albuterol that you need in a month. Like I have one push albuterol inhaler, and that thing lasts me now, I would say 2 to 3 months. Originally that prescription only lasted me a month because it was so bad. And so for people that live in worse area codes than I do, I can imagine how much faster they would run out of it. And cordyceps, that mushroom, is so much cheaper. You could grow it literally anywhere because it's a mushroom, but that information just isn't as accessible.
Yeah, if I could add, I really appreciate Nada and Bryn your perspectives on this. As an asthma researcher myself, I noticed that just the clinical studies and even the basic studies that are trying to find these drugs and treatments for asthma. Racism is rooted everywhere, and a lot of these studies have been focused on white subjects, and that's definitely contributory to the lack of these drugs being efficacious in minority populations. And so not only do we think of in the hospital that racism is rooted there, but even prior to this, and I would add that we are working to make our studies more diverse, ensuring that these treatments are hopefully being appropriate to the populations they're trying to be targeted for. So there is a positive, we're moving forward in identifying the issues and trying to make it more equitable.
If Ray could give some closing thoughts, and then we could say them.
I do have to hop off. Unfortunately, I have yet another call to get on tonight. Today has been so busy. But yeah, I just want to say that like the healthcare system in America definitely needs some changes. I think it could draw a lot from other healthcare systems, like Bryn was talking about maternity leave. We definitely need more protections for women, and I think the Canadian healthcare system can also be an interesting thing to look at. All people in America should be able to have access to healthcare, no matter how rich they are, how much money they have, no matter their class or their gender identity or the color of their skin, or all of these discriminating disparities and factors that people use to discriminate against other people, and how the American healthcare system and the government uses to force certain groups of people down and to not deny them the healthcare that they need, instead of just giving everyone equal healthcare. And the fact is that another thing I wanted to touch on that I didn't get a chance to talk about earlier, and could be a whole other debate, is the fact that the pharmaceutical companies and the drug companies make so much money off medications. Like I know if my medications were not covered under my insurance, they would be so expensive. Like I looked at how much they were, and I pay like $3 per prescription. So it's like every month I pay like $3 times like whatever medications I have. But like without it, it would literally be like $50-$60 for that same thing, because the pharmaceutical companies have access to the means of production, and they can just sell it for whatever price they want without the government regulating it all, and people can literally die because they don't have access to medication that they need. And then other healthcare systems as well, like people can't have access to surgery, like when you're talking about your dad. They literally told him that. Like that is just bullshit. And the American healthcare system really needs to fix itself up a little bit. And I'm just gonna say there are so many disparities in our system right now, and a lot needs to change. And I appreciate being able to have this talk with you guys, and envision some of those solutions, and then hopefully within the next few years we can work towards solutions that work for everybody. But with that, I do have to hop off. So thank you, everyone.
Thank you so much for joining. We appreciated your input. Bye. And I would just, I guess, start off with the closing statements before I hand it over to you guys. I would just say, for this roundtable, I learned a lot. I really didn't take into consideration holistic medicine, how community plays a factor into accessibility. That was really something to think about for sure and research later on. So thank you for that. Thank you for adding that to the discussion, guys. And I would say I am a bit more confused about the healthcare system, but not in a bad way, just understanding that it's so much more nuanced than I previously thought before. Fixing, I guess, making it like Canada's model still has problems, and America following Canada's models won't fix the problems that are so deeply rooted. And even problems within Canada are systemic as well that we don't really address either. So that was something to think about. And I think this was a really good conversation for me to, I guess, get direction in forming a proper, more informed opinion. So thank you guys for that. And if Anada could go next, and if you could call on the next panelist to go next afterwards, that would be great.
Yeah, I think with activism, it's very hard to find spaces where it feels safe to share your opinions with older generations and with younger generations, because in activism, everything feels like an attack, and you can't really share your opinion with other people without feeling like you need to defend it. And so I really appreciate spaces like this where you know that people aren't just listening to make their next point, they're just listening to understand and listening to develop their understandings further. So I just want to say thank you to everybody. Yeah, and about Rowan.
Somber but lovely discussion with all of you. I really enjoyed hearing all the different perspectives and sort of digesting it a bit and getting our elbows into it rather than just scratching the surface layer of issues, as we often do when discussing these types of things. And it's been really enlightening and enjoyable. I'll pass it to Daniel.
Thank you. I'm very glad I was here. I appreciate the range of subjects and perspectives that all of you brought to this. I don't think I have a lot to add. I think I said enough earlier, but thank you. I appreciate being invited, and I appreciate meeting you. Bryn.
Thanks, Daniel. Thank you, everyone, for inviting me to speak today. I really enjoy this topic. I think, healthcare and health in general is so personalized, but rarely do we get to all sit around and really talk about our own individualistic struggles against them and our own experiences versus good versus bad, especially in different places such as Canada. But I'm really appreciative that we can all sit down and talk about it. And obviously, I am an advocate for healthcare disparities and social determinants of health and the eradication of all of those. So it was really nice just to see, the faces that we fight for. So thank you. And Georgina, do you want to go next?
Yes, thank you, for having me. I don't know that I contributed a lot of information, but it was very informative and enlightening to hear a lot of the younger generation's perspective on this topic. So thank you for having me. And let's see, Arjun.
I think, obviously, I'm really grateful for you guys, Omar and you guys, to inviting me here. I think for me, humanize is a weird word, but because I don't, obviously I've heard a lot about the American healthcare system, but I don't know a lot of people in America. So hearing your individual experience is kind of humanize that issue where obviously I know it's a bad system, but hearing individual stories, it's more heartbreaking to hear, and the normalization of oh, if you're mildly sick, I just stay home. But here, you go to the hospital or doctor, just hearing those kind of things, it just kind of emphasizes how I feel about the profit-driven market of healthcare. But thank you. Who didn't? Kevin, you can speak.
Yeah, I just want to echo what everyone else has said, and thanks to the Raven Corps just for bringing everyone together, because you rarely find these instances of different generations coming together to discuss these issues. And we all want what's best is to improve healthcare and improve everything. So I think conversations like these are really good to help towards that effort. Nadia?
Honestly, again, echoing what everyone said, that was awesome. And it was really interesting to learn, at least for me, how so many different communities are suffering from the current faults of the healthcare system differently. So before, I obviously understood, yes, it's faulty. Yes, there's so much wrong with it. Yes, we need to fight it. but I just didn't understand the details about it and how, again, different it is for everybody. So I feel like after hearing this conversation just unfold, it made it much more clear how we can bring change to this healthcare system at the moment.